path to winning isn't easy. What medical treatment does a long-term disability carrier expect in a soft tissue disability claim? Now, I will tell you that medical treatment plays a central role in any long-term disability claim. Insurance carriers and disability plans are going to use the treatment you receive to gauge whether your condition truly prevents you from doing your own occupation or any occupation. I will tell you that in soft tissue cases, this is going to face intense scrutiny. Carriers are often going to downplay the functional limitations caused by slow healing injuries, assuming that most soft tissue injuries resolve quickly with conservative care. However, I'll tell you that chronic injuries, soft tissue injuries, can persist beyond the elimination period and require more thorough documentation of ongoing disability. The first line of attack, by the way, is going to be the disability carrier plan saying that based on your medical records, you do not meet the elimination period. And this is a period that can be 30 days, 60 days, 90 days. I've even seen them as long as a year. And in that time frame, you have to meet the definition of disability as defined by the terms of the policy of the plan. And you're not getting paid in that time frame. Disability carriers think it's an easy win to deny benefits in a soft tissue case during the elimination period. But if you make it past then the question becomes, well, are you still disabled? As that term is defined by the policy of the plan. What they're going to be looking for is treatment, and they're going to be looking for diagnostic studies. So let's start out with the diagnostic studies. They're going to be looking for, well, is there an X-ray? Is there an MRI? Is there a CT scan? Is there an MRI arthrogram that document an injury or a disabling medical condition? Okay, so we see that. What's the physical exam findings? Are these physical exam findings consistent with the diagnosis and the objective medical tests? And sometimes the tests aren't positive, they're negative. But that doesn't mean that you're not disabled. It means that we have to go about proving this case a bit differently. So they're going to look at the physical exam findings. They're also going to be looking at what treatment was recommended for your chronic soft tissue condition. As we know, the treatment legitimately is going to start out conservatively with things like physical therapy, medication, like muscle relaxers, or injections to relieve the pain and inflammation. If these interventions fail, additional steps can include a referral to a specialist, pain management physician, or even a surgeon. One of the things that I like to do is to look at what the nature of the person's soft tissue injury or medical condition is. Is it a bursitis? Is it an inflammation? What is it? What would we expect to see on exam findings? What is the duration guidelines that the carriers say are applicable to this case, and at what point should they recover? What typically do physicians or medical providers see when the condition has not healed in the time that's reasonably expected? And what type of diagnostic studies are ordered to determine why there is these ongoing soft tissue injuries or conditions? Is it an MRI? Is it going to be diagnostic studies like MRI arthrograms? Is it going to be perhaps injections that are diagnostic in nature to kind of tease out what the medical condition is? Or is it going to be physical therapy? Is it going to be inflammatory medication or other pain medication or injections? But as the condition persists, they're going to be looking to the referral to that specialist, the pain management provider or the surgeon. And what they want to see is that your treatment is appropriate in terms of the type of treatment, the frequency, and intensity of treatment. If they think that your care is insufficient, they're going to argue that your condition isn't severe enough to meet the policy's definition of disability. So support from your physician is crucial. And oftentimes we have to get not only detailed APS forms and RFC forms, but there are times when we want to get a functional capacity evaluation, which is an objective measure of the impact of the person's capabilities, and explain via a letter from the doctor that they're endorsing the RFC or the FCE, and that the reason why they're not seeing a progression in the improvement, but rather a chronic condition is X, Y, or Z. We want your physician to explain why that is. We want them to address the lack of progression in improvement, the lack of response, why there's been a lack of response or an incomplete response, why this condition has lasted longer than typical, and what they anticipate your future treatment to be. And I think that taking the extra step and getting this explanation is the difference between a denied claim or a successful one. The other thing that I think is really crucial is that if your physician isn't going to play ball with you, that you, and preferably your lawyer, identify a specialist in this area who would be willing to do an independent medical examination and address those very questions. We lawyers know doctors in our geographic area who are willing to do IMEs, are willing to listen to policyholders like yourself, to take that good history, to do a thorough exam, to recommend studies, to analyze your records, and answer the questions that disability carriers or plans often ask, and which are the basis of a claim denial or termination. So remember, you need to be proactive, but if you're in a situation where your benefits have been denied or terminated, there really is a specific strategy that, in my view, needs to be implemented. So clearly, when this condition persists either beyond the elimination period or beyond the duration guidelines that disability carriers or plans use, having professional assistance is going to be crucial. And I've outlined for you exactly what needs to be done, but you need to remember that you only have 180 days in which to file an appeal. And that appeal is the trial of your case. You can't add anything new once that appeal process is completed. So in our office, we do appeals that are 25 to 60 pages long. We address the medical basis for the denial and, of course, argue the applicable law. But we're taking a comprehensive approach and getting documentation from the physician, having our clients undergo the FCEs or getting IMEs, and taking the necessary steps to rebut element by element the basis of the disability carrier's denial of your soft tissue condition. So you can see that navigating chronic soft tissue injuries requires professional guidance, and it's essential to the success of one of these claims. Thank you for tuning into this week's episode of Winning Isn't Easy. If you found this episode helpful, please take a moment to like our page, leave a review, share it with your family and friends, and subscribe to this podcast. Join us next week for another insightful discussion and episode of Winning Isn't Easy. Thanks for listening.